Hello and welcome to the Midwife Says, where I share evidence-based facts about women's health, pregnancy, birth, and postpartum. My name is Melanie, and I am almost a licensed midwife in the state of Florida. Let's talk about vaginal discharge. This is a topic so many women feel in the dark about, and you shouldn't, because everyone with a vagina experiences discharge, and it's really important to be able to distinguish normal discharge versus discharge that potentially needs treatment. Before we dive in, I want to preface this entire video by saying if something feels off, especially if you're pregnant, please go in. Untreated vaginal or urinary tract infections can be dangerous. They can lead to infections of the entire reproductive system, kidneys, or if left long enough, sepsis. If you're pregnant, all infections, including UTIs, yeast infections, and BV, can lead to miscarriage if left untreated, so please take care of yourself. With that being said, let's start off simple. Looking first at normal discharge. As I said, every person that has a vagina should be experiencing discharge. The vagina is self-cleaning, and discharge is how it keeps bacteria, yeast, or anything else from hanging around and causing a problem. This discharge is usually a milky white color, and slight variations of color are normal from person to person. This is the discharge that you might see in your underwear on a day-to-day basis. It doesn't have a very strong odor, and it usually comes out droplet size, but again, the amount can vary greatly from person to person. Pre-ovulation discharge definitely falls into the normal category. So about 14 days from when your period ended, you may notice that your discharge is coming out more clear and there's much more of it. This is the body trying to create a more favorable environment for sperm to live. So if you're trying to get pregnant or wanting to avoid pregnancy, this is a great sign to keep in mind. And if you'd like a video on that, let me know in the comments below. Moving on to abnormal or potentially pathological discharge. As I mentioned, the vagina is self-cleaning and uses discharge to flush out bacteria or yeasts. However, the system is not a guarantee, and for one reason or another, sometimes pathogens happen. The two most common pathological reasons for abnormal discharge are yeast infections or BV, bacterial vaginosis. The discharge produced with a yeast infection, also called vulvovaginal candidiasis, is pretty unmistakable. This is that white, thick, cottage cheese-like discharge, usually accompanied by vaginal itching or burning, and usually has no smell. This unique discharge is caused by the fungus Candida albicans. This is not an STD or STI. Yeast infections can be caused by a variety of things. Some of these include antibiotic use, washing with soap or sitting in a very soapy bath for too long, birth control. Even being pregnant increases your risk of developing a yeast infection. They're no big deal outside of pregnancy, and they're usually treated with an antifungal medication like miconazole. If you're pregnant, the 7-day regimen is what is recommended. Also, they can be treated with fluconazole, clotrimazole, etc. It's important to note that men and women can both be infected, and both parties need to be treated to prevent reinfection. If you are pregnant, you have to get this dealt with ASAP, as yeast infections can cause preterm labor. Many of these remedies can be found over the counter, but please ask your provider which one you should use first. Let's talk now about BV, or bacterial vaginosis. This is a bacterial infection of the vagina. This is not an STD or STI. BV can be caused by intercourse and altered vaginal pH, which happens when we wash with soap, and even pregnancy. The type of discharge associated with BV is a watery gray discharge that is usually copious. Other symptoms of BV include burning with urination and a very strong fishy odor. This odor is much more pungent than the normal vaginal odor, so much so that sometimes this is used to make a clinical diagnosis. If you think you may have BV, it's imperative that you get treated. Untreated BV can turn into pelvic inflammatory disease, which is an infection of the entire reproductive system. BV is generally treated with oral or vaginal antibiotics such as clindamycin, metronidazole, which is an antifungal. Research does not suggest that male partners need to be treated for BV to prevent reinfection. And what if you have frothy green discharge? This is the result of Trichomoniasis vaginalis, or Trich. This is a parasitic infection, and it is an STI, meaning this is only transmitted by oral, vaginal, or anal intercourse. Other symptoms of Trich include vaginal itching or burning, pain with intercourse, pain with urination, and if you have trich, it increases your risk of becoming infected with HIV, so it's imperative to treat it. It's also important to note that 70% of people infected with trich do not have symptoms. Men are less likely to have symptoms than women. People without symptoms still need to be treated. In order to treat trich, you will have to see your healthcare provider so that they can provide the proper medication, which for women is generally metronidazole at 500 milligrams twice a day for 7 days. It's imperative that any partners you have also be treated so the infection does not continue to be passed back and forth. This infection can cause preterm labor and growth restrictions to your developing fetus. So there you have it, a very generalized list of the most common causes of normal and abnormal discharge. If you're experiencing any abnormal symptoms, please go get yourself checked out so any infections don't advance further, especially if you are pregnant, as every one of the pathologies I listed can compromise the pregnancy. As always, the studies that I used for this video can be found in the links below. Leave a comment and let us know what natural remedies have you used that you feel like everyone should know about. And finally, let me know about any other topics you'd like discussed, or if you are interested in a deeper dive on this subject. Take care of yourselves, and I'll see you next time.